Sciatica pain, excruciating pain that restricts mobility. Have you ever experienced a sharp, shooting pain that starts in your lower back and travels down your leg like lightning? If you're nodding your head right now, you might be one of the millions of people worldwide who suffer from sciatica pain. Today, we're going to dive deep into everything you need to know about this condition that affects up to 40% of people at some point in their lives. I am Iganda, and in the next 20 minutes, I'll walk you through exactly what sciatica is, why it happens, and most importantly, what you can do about it from the website Friends Corner 682, where we have videos in which we explain serious medical conditions in an easy-to-understand manner. We'll explore the anatomy behind the pain, identify the root causes, discuss prevention strategies, and examine all your treatment options, from conservative approaches to surgical interventions. Additionally, I'll provide specific dietary recommendations and post-treatment care tips that can significantly enhance your recovery. Disclaimer: before we begin, let me emphasize that while this information is thoroughly researched and based on current medical understanding, it's not a substitute for professional medical advice. Always consult with healthcare professionals for proper diagnosis and treatment. Now, let's get started on your journey to understanding and overcoming sciatica pain. The sciatic nerve basics. To understand sciatica, we first need to understand the star of the show, the sciatic nerve. This isn't just any nerve, it's the longest and thickest nerve in your entire body, roughly the width of your thumb. The sciatic nerve actually starts as 5 separate nerve roots that exit your spinal cord at the L4, L5, S1, S2, and S3 vertebrae levels. These roots come together like tributaries forming a river, creating the massive sciatic nerve. From its origin in your lower spine, the sciatic nerve travels through your pelvis, passing underneath or sometimes through the piriformis muscle. We'll come back to this important detail later. It then continues down the back of your thigh, behind your knee, and splits into 2 branches, the tibial nerve and the common peroneal nerve. These branches control sensation and movement in your lower leg and foot. The sciatic nerve is responsible for some pretty important functions. It provides sensation to the back of your thigh, most of your lower leg, and the top of your foot. Motor-wise, it controls the muscles that bend your knee and move your ankle and toes. This explains why sciatica can affect not just sensation, but also strength and your movement. The spinal connection, the nerve roots that form the sciatic nerve, exit through small openings called foramina, located between your vertebrae. These spaces can become narrow due to various factors, putting pressure on the nerve roots. Your spine also has protective discs between each vertebra, and when these discs are compromised, they can press against the nerve roots, triggering sciatica symptoms. Pain characteristics: sciatica pain is distinctive and often unmistakable. Patients typically describe it as a sharp, shooting, or burning sensation that follows the path of the sciatic nerve. Unlike general back pain that stays localized, sciatic pain travels. It's like an electrical current running from your lower back down through your buttock and leg. Some people experience it as a constant ache, while others have intermittent sharp jolts. Associated symptoms beyond pain: sciatica can cause numbness, tingling, or a pins and needles sensation in your leg or foot. You might notice muscle weakness, making it difficult to lift your foot or push off when walking. Some people experience a burning sensation or feel like their leg is going to sleep. In severe cases, you might have difficulty controlling your bladder or bowel. This is a medical emergency requiring immediate attention. Pain patterns: the location and intensity of sciatic pain can vary depending on which nerve root is affected. L4 nerve root compression typically causes pain and numbness in the thigh and inner lower leg. L5 involvement often results in weakness in lifting the foot and pain radiating to the top of the foot. S1 compression commonly causes pain in the outer and back of the leg, potentially reaching the little toe, along with difficulty standing on tiptoes. Root causes of sciatica: the most common cause of sciatica is a herniated or slipped disc. Your spinal discs are like jelly donuts. They have a tough outer layer and a soft inner core. When the outer layer weakens or tears, the inner material can push out and press against nearby nerve roots. This typically happens at the L4, L5, or L5S1 levels, directly affecting the sciatic nerve roots. Spinal stenosis. Spinal stenosis involves the narrowing of the spinal canal, or the openings where nerve roots exit. This can occur due to age-related changes, including thickening of ligaments, bone spurs, or disc degeneration. As these structures encroach on the available space, they compress the nerve roots, leading to sciatica symptoms that often worsen with walking or standing. Piriformis syndrome. Sometimes the culprit isn't in your spine at all. Piriformis syndrome occurs when the piriformis muscle, located deep in your buttock, becomes tight or inflamed and compresses the sciatic nerve. This can happen due to muscle imbalances, prolonged sitting, or repetitive activities. Interestingly, in about 15% of people, the sciatic nerve actually passes through the piriformis muscle, making them more susceptible to this condition. Other causes. Several other factors can contribute to sciatica. Spondylolisthesis occurs when one vertebra slips forward over another, potentially pinching nerve roots. Degenerative disc disease involves the gradual breakdown of spinal discs. Pregnancy can cause sciatica due to hormonal changes and the growing baby putting pressure on the nerve. Less commonly, tumors, infections, or severe muscle spasms can compress the sciatic nerve. Prevention strategies. Posture and ergonomics. Prevention starts with good posture and proper ergonomics. When sitting, keep your feet flat on the floor, maintain the natural curve in your lower back, and avoid slouching. If you work at a desk, ensure your monitor is at eye level and take regular breaks to stand and move. When lifting objects, bend your knees and keep your back straight. Let your legs do the work, not your spine. Exercise and strengthening. Regular exercise is crucial for preventing sciatica. Focus on strengthening your core muscles, which support your spine like a natural brace. Low-impact activities like swimming, walking, and yoga can improve flexibility and maintain spinal health. Specific exercises targeting the glutes, hamstrings, and hip flexors can help maintain proper muscle balance and reduce nerve compression risk. Lifestyle modifications. Maintain a healthy weight to reduce pressure on your spine. If you're a smoker, quitting can improve circulation and promote healing of spinal tissues. Choose supportive mattresses and pillows that maintain spinal alignment during sleep. Avoid prolonged sitting or standing in one position. Movement is medicine for your spine. Stay hydrated, as proper hydration helps maintain the health of your spinal discs. Treatment options. Conservative approaches. Initial management. For any treatment, however minor it may be, consult your licensed medical professional before trying. For acute sciatica, the initial approach typically involves relative rest, not bed rest, but avoiding activities that worsen symptoms. Ice therapy for the first 48 to 72 hours can help reduce inflammation, followed by heat therapy to promote healing and relaxation. Gentle movement and walking as tolerated can prevent stiffness and promote recovery. Physical therapy. Physical therapy is often the cornerstone of conservative sciatica treatment, which your medical practitioner is likely to advise. A skilled therapist can identify muscle imbalances, teach proper movement patterns, and prescribe specific exercises to address your particular condition. Manual therapy techniques, including spinal mobilization and soft tissue work, can provide relief. The goal is not just symptom relief, but also preventing recurrence through improved strength and flexibility. Medications. Over-the-counter pain relievers like NSAIDs can help manage pain and inflammation. However, let the medical professional prescribe it. For more severe cases, doctors might prescribe muscle relaxants, oral corticosteroids, or neuropathic pain medications like gabapentin. Each medication has benefits and potential side effects that should be discussed with your healthcare provider. Alternative therapies. Many people find relief through alternative approaches. Chiropractic care can help improve spinal alignment and reduce nerve pressure. Acupuncture has shown promising results for some sciatica sufferers. Massage therapy can help relax tight muscles and improve circulation. While evidence varies for these approaches, they can be valuable components of a comprehensive treatment plan when provided by qualified practitioners. You can discuss these therapies with your doctor and follow his advice. Advanced treatment options: injections. When conservative treatments aren't providing adequate relief, epidural steroid injections might be recommended by your doctor. These involve injecting anti-inflammatory medication directly into the space around the affected nerve roots. This can provide significant pain relief for several months, allowing for more effective participation in physical therapy. However, temporary relief potential side effects may include bleeding, infection, or rare nerve damage, and the steroid effects are not permanent. Surgical options: surgery is typically reserved for severe cases or when conservative treatments have failed. Microdiscectomy involves removing the portion of a herniated disc pressing on the nerve. A laminectomy creates more space for the nerves by removing part of the vertebral bone. It can provide definitive relief for appropriate candidates, especially those with clear structural problems. Your doctor will make this decision. But surgical risks, recovery time, potential for scar tissue formation, and no guarantee of complete pain elimination. Diet and nutrition. During sciatica, nutrition plays a crucial role in managing inflammation and promoting healing. Focus on anti-inflammatory foods like fatty fish rich in omega-3s, leafy greens, berries, and nuts. Turmeric and ginger have natural anti-inflammatory properties. Limit processed foods, excess sugar, and foods high in saturated fats, which can promote inflammation. Specific nutrients ensure adequate intake of vitamin D and calcium for bone health. B vitamins, particularly B12, support nerve function and repair. Magnesium can help with muscle relaxation and pain management. Stay well hydrated, as proper hydration supports disc health and overall healing. Consider consulting with a nutritionist for a personalized anti-inflammatory diet plan. Foods to limit during acute sciatica episodes. Limit foods that can increase inflammation, including refined sugars, processed meats, and excessive caffeine. Alcohol can interfere with sleep quality and healing. Some people find that nightshade vegetables, tomatoes, peppers, eggplant, can increase inflammation, though this varies individually. Keep a food diary to identify any personal triggers. Post-treatment care and long-term management. Gradual return to activity. Recovery from sciatica should involve a gradual return to normal activities. Start with gentle movements and slowly progress intensity and duration based on your symptoms. Don't rush back to high-impact activities or heavy lifting too quickly. Listen to your body and respect the healing process. Ongoing prevention. Maintain the healthy habits you've developed during treatment. Continue with your exercise routine, focusing on core strengthening and flexibility. Regular check-ins with your healthcare provider can help monitor your progress and address any concerns early. Remember, preventing recurrence is just as important as treating the initial episode. Conclusion. Key takeaways. Sciatica is a complex condition, but understanding its causes and treatment options empowers you to take control of your health. Remember that recovery often takes time, and a comprehensive approach addressing both symptoms and underlying causes typically yields the best results. Call to action. If you're dealing with sciatica, don't suffer in silence. Work with healthcare professionals to develop a treatment plan that's right for your specific situation. Share this video with anyone who might benefit from this information, and subscribe for more health contents. Most importantly, take that first step toward better spine health. Your future self will thank you. Final reminder, remember, this video is for informational purposes aimed at raising awareness about a serious medical condition. It is not a substitute for professional medical advice. Always consult with a qualified healthcare provider for proper diagnosis and treatment of your specific condition.